Hello, and welcome to the third session in the Mental Health Matters educational series, Putting the Face Back in FaceTime, Rebuilding Relationships After Social Distancing. The session will last approximately 45 minutes with an opportunity for questions and answers. Viewers can submit questions at any time during the session by typing into the chat box. Some questions may have the opportunity to be answered live during the show. Please note, everything is confidential from signing into the session to the questions that are typed and read live from the presenters. Thank you for joining us today. The final session of today's series will be presented at 3:00 p.m. Exhale, Reconnecting the Mind-Body Disconnect. I'm excited to introduce the next session, Putting the Face Back in FaceTime, Rebuilding Relationships After Social Distancing, presented by Ashley Ware with Jolene Wallace. Ashley Ware is a dually licensed marriage and family therapist and licensed clinical addiction specialist. She has worked at ECU Health Medical Center in behavioral health for over 5 years. Ashley believes in a holistic approach to mental health and places emphasis on the importance of relationships to improve our health. Jolene Wallace will be our host today. She has worked at ECU Health Medical Center for over 22 years. She currently serves as the program coordinator for behavioral health and is one of the co-facilitators for Mental Health Matters. We will now turn it over to Jolene and Ashley.
Thank you, Rhonda. Thank you, Ashley, for joining us here today. I wanted to talk to you first about your title, Putting the Face Back into FaceTime After Social Distancing. I thought it's kind of perfect as we're trying to step out of the pandemic. And what can you tell me about your title?
Thanks for having me. The title, Putting the Face Back in FaceTime, just came from my experience, and I'm sure everyone's experience of, having to connect with our loved ones and our friends and our coworkers through technology. We saw such an increase in FaceTime visits and WebEx and Zoom meetings. And now that we're emerging out of the pandemic, I'm hopeful, and I'm sure we all are, that we're able to now put those faces back with those interactions. So.
That's great. I love it. Love it. Ashley, what are some things that you have seen in relationships since COVID?
So I think relationships in particular took a pretty hard hit with COVID. So many significant changes in our lives happened, whether that was an increase in time spent together with our loved ones at home, our immediate families, or vice versa, the opposite of that, where we were lonely and isolated from our loved ones and our colleagues and our friends.
What would you say are some important things in regards to relationships as far as the human and the human bond?
So I read an article once that gave like a pseudo-scientific formula for the human bond, and it was time and affection and togetherness. And with COVID, we saw that formula be disrupted, specifically the togetherness piece. We either had the increase of that, which could create some difficulties, or we had the absence of that, which also created some difficulties.
What would happen if, I guess for me, or anyone out there watching today, that if one of those things were removed in a relationship with someone, if you were maybe together too much, how could that cause a relationship? What are some of those things that maybe would cause?
So the increase in togetherness, the research throughout COVID and the impacts of COVID are still very preliminary, but what we've seen so far, the significant impacts of the impact financially when people lost employment through COVID. The increase in togetherness, we also saw a significant increase in domestic violence. I believe it was around 12% increase in domestic violence for relationships that had that increase in togetherness. We saw an increase in conflict, which also had the impacts on children in the home and their performance as well.
Right, being a school teacher, which I am not one, that was very difficult for me and my family, as well as trying to try to figure out to have some of your own time alone during those times. I would imagine it would be very difficult. Where me personally, I have a house full of people where it might be a little bit more difficult for someone who is, we were saying that they don't have anyone at home. It may be just themselves and they've lost all communication from the outside. Do you think things for them and the human bond for them may have triggered some of the same things during the time of COVID?
Sure. The isolation that individuals experienced, you could see changes in appetite, energy level, activity level, difficulty concentrating, difficulty with sleep, even physical reactions, headaches, body pains, stomach pains. We also saw quite an increase in alcohol consumption and tobacco use and other drugs as ways of coping during the pandemic. And so there was a lot of negative impact that the isolation could have had. And also with the increased time together, if it was an unhealthy relationship, we might have seen that be a trigger for our mental health, a mental health trigger or a stressor.
So as we talk today about hopefully being on the other side of the mask of the pandemic, let's say, and on the other side of the worst parts of COVID. I mean, I know COVID will probably never go away and there's strains out there for us, but how do we reemerge from COVID through growth and diversity? What are some things that maybe you can recommend or suggest?
Yeah, I think it's important to go at your own pace, to understand what you're comfortable with and following your comfort level with that. And so even when we go out to the grocery stores or to events today, we see people in different comfort levels. Some people still wear their mask and some do not. And I think it's important just to be comfortable and go at your own pace. I think it's also equally important to not avoid things entirely. And so a lot of what we've seen in the mental health world is a significant increase in anxiety. And I think that's kind of twofold. Sometimes anxiety will cause you to avoid things altogether. And so I think with this reemergence or to emerge out of the pandemic, it's important to take it slow. Go at your own pace, but don't avoid things entirely. Discuss these changes with other people, your loved ones, your friends, your coworkers, and then also make time to relax at the end of the day, to decompress, because it can be stressful to kind of reemerge after such a difficult time.
So we're talking about emerging and rebuilding relationships, and sometimes rebuilding gives us an opportunity to make things different. How do you feel about that?
Yeah, so there was another article about growth through adversity, and I think that it's important to note that the growth through adversity is growth in itself. So the article used an example about if an earthquake comes in and takes down a building, we likely wouldn't come back and build that building exactly the way it was, but we build it back better. And so growth through adversity is just that. Coming out of this pandemic, we hope to grow as a community. The things that came about during COVID or that were highlighted, they didn't necessarily come about during COVID, but were maybe highlighted during COVID.
Right.
Hopefully we will be able to come together as a community and make the necessary changes to improve our lives.
I love that example because you're absolutely right. Whether a building comes down or a tornado or a hurricane comes through, we don't ever build things the same way. We build them stronger. We figure out how to resist and be better for the next time. So I think that's a key point in stepping back out into socialization today. But with that social anxiety, like we had just touched briefly on about everybody being at different places, my girls and I will go shopping sometimes, and We'll see people wearing masks still and very hypervigilant, and we may not always wear our masks. My girls ask why we're not wearing masks, and some people are. And what would you suggest or maybe recommend on how to talk to kids or families about that?
I think it's important to share your comfort level, and I think that you have to follow that comfort level and make decisions based off of your needs and your family's needs, and not every family is the same, and it's important to follow that comfort level, but also be respectful of other people and the decisions that they make for themselves and their families.
So how would someone go about, maybe if they're listening to us today, maybe about starting to normalize different comfort levels, maybe like starting some activities maybe that they used to do, or
Yeah,
what would you?
absolutely. I think that it's important to engage yourself in things that you enjoy, and so being able to implement social functionings, or scheduling time to visit with family that you haven't seen in a while, being able to take it slowly, but be able to reacclimate yourself to some of those ways of living.
And I think as being an individual, as a mom, as a daughter, that empathizing with the community and knowing that not everybody is going to be at the same place that you may be or that I may be. Do you think empathy is an important part in our day-to-day relationships, whether they're personal or professional relationships?
Absolutely. I think empathy is the key to being able to take on another person's perspective and to be able to understand them better. And when we approach situations and people with empathy, then we can have a better understanding of their experiences and hopefully be able to come to some compromise.
And when I say empathy, sometimes people kind of confuse the words between empathy and sympathy. Could you maybe explain that a little bit for us?
So sympathy is essentially having sympathy for someone, feeling sorry for their experience, and empathy is really getting in the trenches and being able to understand their experience from their perspective.
Okay, great. So I want to talk to you today and everybody watching about healthy relationships.
Yeah.
As we start to reemerge, and what a healthy relationship looks like. Could you maybe talk to us a little bit about that today?
Yeah, well, I mean, we were just speaking of empathy. I think empathy is a component. Not everyone's relationship is going to look the same, but a healthy relationship should encompass a couple of main characteristics: trust, communication, empathy, appreciation, respect. Healthy conflict resolution. I think that's a big one, that especially when we think healthy relationships, we think, oh, there's no conflict in healthy relationships, and it's quite the opposite. And I think it's also important to note in a healthy relationship, there are boundaries and individuality.
Okay. So I'm going to bring you back to, you mentioned healthy conflict resolution.
Yes.
So can you explain that a little bit to me and what you mean? Maybe what healthy conflict resolution looks like in a relationship?
Yeah. So research suggests that the way a couple argues or doesn't argue is indicative or could predict the relationship success. And so I think that it's important to understand that even in healthy relationships, there's going to be disagreements, arguments. It's how we communicate with each other in those moments, being able to respect the other person's perspective and come to an understanding of their point of view, and being able to resolve the disagreement or the disagreement in a respectful way.
Interesting. You also mentioned regarding individuality in a relationship. I would love to hear a little bit more about that and what you mean by being an individual in a relationship and how that works.
Yeah, I think when we think of people, we can appreciate everyone's differences, and especially within a relationship, it is important to to note that it is okay to have your individual self. Individuality, I like to think of as like a Venn diagram. And so in the Venn diagram, we have ourselves and we have our partner, and then we have togetherness in the middle. And it is equally important for all three pieces to be present. And so to not absorb, to not lose yourself in that relationship, to be able to have your own ideas and values and beliefs, but also being respectful, and coming to a middle ground is important. I mean, if we were all the same, how boring would that be?
Right.
We would probably run out of things to talk about if we all had the same opinion. So
You're exactly right. So one thing also that I would imagine that would be important in a relationship would be self-care and how to
Absolutely.
improve self-care.
Absolutely.
What are you able to tell me, or what, in your perspective, does self-care look like?
So I think at the very core of self-care, we should explore what our inner dialogue is, what we tell ourselves about ourselves. And oftentimes I'll tell my clients, would you speak to someone else the way that you speak about yourself? And oftentimes we're much kinder to other people than we are to ourselves. So I think self-care starts in that regard with how we think and speak about ourselves. And then from that, there are a few tangible things that we can do for self-care, enjoyable activities, going for a walk, getting outside, getting in touch with nature. Maybe it's just a hot shower or 15 minutes of reading your favorite book, getting involved in and volunteering or getting involved in a community effort that really fulfills you and refuels you.
Sometimes, Ashley, when people think about self-care, we think about that being selfish. We're being selfish because we're putting ourselves first. What can you tell me about that?
I like to challenge people on that. I view self-care more as self-preservation. And so it comes to my mind, and a lot of that I do work with my clients, I use the analogy of, if you've ever been on an airplane, the pilot will come over, or the flight attendant comes over the intercom and talks about, if the oxygen mask drops from the ceiling. If we lose oxygen, the oxygen mask drops down. It's important to put that on yourself before you put it on someone next to you. And as a mother myself, I think that's really foreign, because my gut reaction would obviously be to help my child or my husband next to me. But I think it's important to note that if I run out of oxygen, if I run out of fuel for myself, I'm not then able to care for my loved ones. And so it's self-preservation to be able to care for myself so that I am a whole, happy person, so then I can care for the ones that I love.
Wonderful. If someone doesn't feel comfortable or capable improving their relationships on their own, or they're not really sure how to do it, are there resources available to help them?
Absolutely. I would encourage, if you find yourself feeling stressed or needing some additional support, reaching out to a friend or family member, a clergyman, your primary care provider, therapist, just reaching out.
So with that, Ashley, as you know, working in the mental health field, there is a big stigma out there that that mental health carries. How do you feel about that, or what are your opinions on that? And as far as people not being afraid to get help and saying that it's okay.
Yeah, I'm hopeful that we're moving in the right direction, and I believe that we are, associated with the stigma around mental health. I think it's important to note that you don't wait to go to a mechanic until your car breaks down. You go and you get maintenance on your car. You get your tires rotated, you get your oil changed, you wash your car, you vacuum your car. We don't wait for it to fall apart before we go and get help. And the same is true with our mental health and our physical health. Reaching out for help and being able to maintain your mental health is important. It's important to your functioning and to your relationships.
So it's nothing to be ashamed about.
Absolutely not.
Okay. How would someone know if therapy is right for them?
I think it's important to note that therapy is a safe space, open dialogue, non-judgmental, unbiased space. And I think that it's important to note that therapists don't tell you what to do, right? It's processing your experiences and coming to your own conclusion with the help of a professional, being able to give you some skills and some tools needed in that process.
Okay, because that was my next question. What, if someone has never been to therapy as an adult or as a child, what is the process? What can you expect or they expect aside from the confidentiality, which we already talked about, that they can get from therapy? Is it a commitment? Is it a one-time you go and that's it? Is it a rapport that you have to build?
I hate to say that it depends. I think it depends on your need, but I think the rapport is first and foremost. The biggest change that we see in therapy specifically is the rapport and the relationship between therapist and client. And so it's important to feel connected and feel like you can relate or you connect with the person that you're seeing. Therapy is also should be a non-judgmental, unbiased space for you to be able to share your experiences.
Okay. Do you think there is a specific therapist for each kind of area, like for my children, or is it based on the therapist and kind of what they're looking for, or what kind of what suits their needs or what their comfort level is?
Mm-hmm. I don't think you could go wrong with any therapist. Their background and training may vary some. I think that it is important to look at the therapist. I mean, we're talking about technology and all the changes that have happened with COVID. It can also be a great resource. So when you're searching for a therapist in your area, being able to identify their areas of expertise and specialties. But ultimately, you cannot go wrong just getting there. If you get there and they're not able to meet your needs, they will give you a referral to the appropriate place.
Okay, that's great. I'm just going to check to see if we've got any questions coming in. Again, if you guys have any questions out there that you would like to send to Ashley as we're here today, just to talk about getting back out there with stepping outside of social distancing and seeing what steps we have to take to maybe feel more comfortable and reemerge back into our world today as we know it. It doesn't look like there's any questions. So I just wanted to thank you and appreciate you so much for coming here with us today. And thank you all again. And hopefully we'll see you guys at 3 o'clock. I'm going to go ahead and turn it back over to Rhonda.
Thank you, Jolene and Ashley, and thank you to the audience for taking the time to listen to our expert today on mental health matters. If you would like to hear this session or any of today's sessions again, you will be able to locate them at www.ecuhealth.org/behavioral health. We do hope to see you back at 3:00 p.m. for our final session, Exhale, Recovering from the Impact of COVID. Thank you.